Hi, it's Dr. Tyron Minty and welcome to this week's Wednesday Wellness Tip. Today we're going to continue our discussion about the immune system. And if you didn't get a chance to look at some of our earlier videos, please take a peek. They're brief, but they're worth it. The reason why we're going into any detail at all on the immune system is so that you can understand why you're taking certain nutrients and why these nutrients may be helpful for boosting immunity. There's very little discussion about that these days. Let's have a look. The immune system is a composite of different organs and structures. Please see other videos for details. Today we're going to focus on bone. That's right, bone is immune tissue, and the inside of the bone is where many of the immune cells are made or birthed, and then they leave and go out to other parts. Today we're going to talk about a cell that makes up just less than 0.05 or 5% of all the white blood cells you have. It's the one that occurs least frequently. It is called a basophil. B-A-S-O-P-H-I-L. And this cell is the largest of all the white blood cells, but is found infrequently. And it has some specific jobs. You'll recognize these. If you ever get the sniffles, especially in the spring, do you know someone who has asthma? Or have you ever heard of a person who might eat a peanut or be exposed to an allergic substance and go into some type of allergic shock? Well, one of the reasons why is because of this cell. It is loaded with chemicals that cause the body to inflame and oftentimes cause an exaggerated response, especially when there are imbalances in omega-3 and omega-6 fats. We've been talking about that through all of these episodes. And omega-3 fats come from fish oil, and the omega-6 fats come from the deep fried vegetable oil oftentimes that people use. And it also comes from seeds. So when people have an imbalanced diet and they only eat seeds and bread, they make the body inflame more, and more of these cells come around. So as soon as they're exposed to some sort of allergen, the response is exaggerated. So basophils make chemicals that cause allergies, and there are a lot of them. Basophils are implicated in most asthmatic cases. There are many different types of asthma, but clearly these cells make chemicals that make the asthmatic attack worse, and maybe it can be modified with the right supplementation. Finally, we already mentioned this cell relates to severe allergic reactions, also called anaphylactic shock. Imagine that if you could decrease your odds of anaphylactic shock simply by trying to balance the omega-3 to omega-6 ratio. It is a wonderful starting point. While it might not guarantee a cure, anyone who has this type of immune problem might want to investigate how it can be done with omega-3 fat balancing. Let's summarize this. We talked about the immune system and this wonderful cell called the basophil, which comes from the bone and is responsible for lots of allergies and allergic-like symptoms in the spring or any time during the year. Omega-3 fats may improve the immune function of basophils. How does it do that? The omega-3s decrease the number of basophils that are in the blood, and they also decrease the release of these chemicals that cause the inflammation. So they effectively, once again, turn the immune system off or allow it to function in a better balance. They also may decrease allergic reactions in asthma and in allergies. Keep all that in mind. If you know someone who has asthma or allergies, refer them to the practice or go to someone who's qualified and knowledgeable about this matter so they can get help. This class is for educational purposes. It is not meant as something for you to go out and do, but it is meant to inspire you to take action and get help. Likewise, I have Dr. Tyron Minty's Pro-Mega Balance, something that I formulated to change the omega-3 to 6 balance and to help deal with the problems of inflammation and immune imbalances caused by this deficiency. Think of Dr. Tyron Minty, Go on our website if you have any questions, or send us an email. But that's it for today. Please subscribe and tell more people. Thanks.